Hello, ladies and gentlemen. This is Brad Gilmore. I'm doing a presentation on Chapter 7 for learning disabilities. Now, to get into learning disabilities, we need to define what that is. The definition of a learning disability is a disorder in one or more of the basic psychological processes involved in understanding or using language. It affects the ability to listen, think, speak, read, write, spell, and do certain mathematical equations. Now, some disorders may include conditions as perceptual disabilities, could be brain injury, dyspraxia, dyslexia, and developmental aphasia. Now, disorders do not include visual or hearing disabilities along with motor disabilities or emotional disabilities. Lastly, children may not have a cultural or economic disadvantage to have a learning disability. It is estimated that a third of all children are identified as learning disabled. They're referred for special education because of, reading problems. Now, many children and adults with dyslexia show a significant deficit in visual naming speed compared to a typical reader. Within these deficits, there can be written language deficits. These can cause problems in writing and spelling. You can also have a mathematical underachievement, and these problems can be caused on every grade level. With learning disabilities, you can also have behavioral problems. Now, some students with learning disabilities display behavior problems in the classroom. Now, research shows a higher than normal rate of behavior problems among students with learning disabilities. Now, a defining characteristic of students with learning disabilities is specific, and there is a significant achievement deficit in the presence of adequate overall intelligence. Let's get into ADHD. ADHD, or Attention Deficit Hyperactivity Disorder, is a commonly used term for diagnosis of students with learning disabilities. Students with ADHD will have difficulty focusing at times and will also engage in high rates of purposelessness or inappropriate movement. ADHD is not a disability category, but about half of all the students with ADHD receive special education. Also, drug therapy and behavioral-based interventions are two of the most widely used treatments approached by educators. Drugs that are used are normally Adderall, dioxazine, or dextrine. Learning disabilities is by far the largest of all special education categories. Roughly 2.9 million students from ages 6 to 21 receive special education under their specific learning disability category. This means basically 5 out of every 100 students have a learning disability. Just as there are many types of learning disabilities, there can be many causes. Some of these causes can be brain damage or dysfunction, heredity, a biochemical imbalance, or environmental factors. Brain injury or some type of central nervous system problem can be the cause for brain damage. Now, genetics, they can be caused by what we get from our parents or our heredity. Now, a biochemical imbalance means the children are not getting the proper nutrition that their brains need to function at a high level. Some researchers believe that vitamin supplements can offset this. Impoverished living conditions and the early onset of poor instruction can influence environmental factors. There are many assessments to be given for students with learning disabilities. Standardized tests can be used along with criterion reference tests. Now, criterion reference tests, these are tests that are different because they define specific skills that a child has learned and the skills that are required for instruction. You can use informal reading inventories. You can use them because they provide useful information for planning instruction. This has also led to greater use of a teacher-developed and administration test in areas for reading for the students. Lastly, you can use curriculum-based measurement, and directly each day you can measure children in the classroom for a daily assessment. You can have many educational approaches. Some educational approaches have been developed over the years, and the shift has been moved to more of an instructional focus. Some educational approaches are explicit instruction that involve using carefully designed materials and activities that are designed to enable students and make sense of new information. Content enhancements will also be available when students will be lectured by a teacher and assigned reading in textbooks. The student will be responsible for high vocabulary, content-dense texts. Guided notes and graphic organizers will also be available to a student during this instruction. Now, IDEA requires that students with disabilities be educated with their non-disabled students and have access to core curriculum to the maximum extent possible. They can only be removed from the regular classroom if it is a necessity and that their disability requires it. Consultation of a teacher will provide support to the regular classroom and to other school staff that will work directly with the student. The student may need a resource room. Now, a resource room is a specially staffed and equipped classroom where students with learning disabilities come for one or several periods during the school day. Students may also go to a separate classroom. This means that the student will be working with a specially trained teacher in their disability. There are current issues and future trends. You have to look, does the child have a learning disability? The discussion of what constitutes a true learning disability will no doubt go on for some time. Assessing children with learning disabilities and problems can effectively change the course of their academic career. Assessment of a child's learning problems is important and needs to be done correctly. All students with learning disabilities need to start in a regular classroom. Students need to start in a least restrictive environment, or LSE. Once a child has been assessed with a learning disability, the option can be made to move them to a learning disabled or full inclusion room. You have to have a positive focus. In teaching a growing student, it is always important to have a positive focus, not only for them, but for their parents as well. If a student has a positive focus, he or she can gain confidence and will be key for them in learning. Always want to focus on the positive qualities when you are teaching them. In summary, we have to define what a student with a learning disability is and what characteristics there are. Also pay attention to students who may have ADHD and what those signs are. What is the prevalence of a learning disability and what are the causes? Assessment is key, and what educational approaches will be needed. Thank you very much for your time. I do appreciate it, and I hope you enjoyed this presentation.